Okay, so chapter 11, we talk about the importance of health, disability, and long term care insurance. You may not want all three, but it is important to have all three. Um, and so we are going to, as I had a teacher when I was in college say, we must be sure and cover our assets. And we are considered as a human and as the breadwinner and as the person making money and as the person that's employed, we are considered an asset and we must cover that also. So that's where health insurance comes in, disability and long-term care insurance, because you want to be sure, like your other things, that you've got some money to offset something if the unthinkable happens. Health insurance is pretty basic. The others are kind of, you don't want to think about them, of course. But health insurance is a way to protect against economic loss due to illness, accident, or disability. If you are out from your job because of an illness, it may just be a day. You usually get paid leave for a day. You have a sick day, etc. You don't think about it. If you're out because of a car accident and you have to be out for, say, a week or 2 weeks for recovery, it goes a little longer. And so you want to be sure you have something covering your bills because you don't have income coming in. You want to be sure you've got something there for that. And then, of course, if you become disabled or something that's more long term, again, you're missing your income. And a lot of times employers will provide something to help with that because they could then put you off on that. That pays your salary. They don't have to pay it. And they're not paying double salary or anything like that for that. So sometimes that's one of the things they look at. The US has the highest per capita medical expenditures of any country in the world. I can get on a big old hairy soapbox about our health insurance, about how it's run and about how it's kept and et cetera. Um, I'll try not to because I know you don't want to hear all that. But we are the most expensive. We also are a leader in research, which is where some of that most expensiveness comes into play. But we also, instead of having a lot of competition, have minimized the competition and have conglomerates. And in the theory of economics, we know that that's not a good thing either. Excuse me, I apologize. We need competition to keep prices down. Companies, insurance companies are now controlling a lot of what hospitals charge, what doctors charge, et cetera. And so I don't agree with that part either because if you go to a hospital, you want to make sure you're getting the best care possible, not what the insurance company says you should have care for. The average per capita cost for healthcare was estimated to be about 13,500 in 2022. I'm sure that's only gone up. There's administrative costs, of course. They have huge buildings, they have perks, they have big CEOs. Um, if you ever want to get me on a conversation, tell me how your health insurance premium has gone up, and then the next week, let's read an article that says that the healthcare CEO of that insurance company that you're with just had the biggest salary on record, and so there's administrative costs that go to that. It's not just a bare bones thing covering your cost of insurance. So again, it needs some work, it needs some tweaking. I don't have the answers. It's a big booger to try to tackle and do. It's kind of like eating an elephant. You have to eat one section at a time, and that's what we have to do is do some reform with that. But all that to say, because healthcare is so expensive, you really need insurance to offset it. Insurance is your best choice for that. Trying to save and have enough money for a surgery is kind of expensive because surgeries can run anywhere from $13,000 to $25,000 minimum for just a in and out kind of thing. So it's a lot of cash. So again, insurance is our best way to offset that risk in risk management. Why does healthcare cost so much in the US? Well, we have sophisticated technology. We have expensive technologies. Sometimes there can be a duplication of tests. If you see one doctor and then you see a specialist, they might want to run their own exact tests that were just run. And so that can be a problem. You because you're paying out of pocket twice for those things, or paying your insurance is paying twice. Um, some insurance companies and some doctors, there's always crooked out there. If there's a way to make money, there's always somebody trying to figure out the system. So just be wary and be aware and know that you have a right as a patient to stand up and say, "Hey, they just did this test. Can't you use those numbers?" And find out if they can't, why. Um, so that's one of the things to keep out for. It's also labor intensive because, of course, they have to have people doing stuff. They've tried to do some AI stuff with insurance, but it's really not good because it gets kicked out. Then you have to have somebody key in the right code on the doctor's end as well as the hospital and insurance company's end. Um, there's limited competition, which again is my big thing. If there's more competition, prices usually are down lower because they're trying to outbid each other. And sometimes they can use the most expensive. test out there when a cheaper one would do. That's another reason you just kind of be up on it. And then, of course, the biggest thing is we have a bunch of people in the United States, and we have baby boomers, which are that 50, 45 to 64 or whatever that is, that are all getting older and they're all living longer. So between those two things, you've got a bunch of people that are aging that need health care and need expensive health care, and you've got a population that's living longer, which means they can no longer say, well, on average, we're going to quit paying at 80 because everybody dies. It's now 100 to 120. So that makes a big difference. So they're looking at that too. So that makes a big difference. And of course, there can be fraud, waste, and abuse in healthcare. Definitely something to watch out for. You always can read about a doctor that figured out a way to quote unquote rip off Medicaid or double bill Medicaid with no patients, and then they get arrested. There was recently a doctor in Springdale who got charged with that. There was a doctor in Fayetteville who got charged with that not too long ago, probably about 5 years ago. So, it's just worth kind of Googling them, research them, and make sure before you see someone that they haven't had that issue before. Typically, they lose their medical license. Today's courts are a little funny, so they may not, but you want to be sure of that. And always look over your fees and charges. Now, they may not give you one at the doctor's office, but when you get your EOB or explanation of benefits from the insurance company, it'll list everything. See if there's something on there that you didn't have or a test that you didn't do, that kind of thing. My aunt is always, she's 92 now. She's always of the worry that someone is ripping her off. There's something out there. She hears all these stories. She lives in an assisted live or a senior living place, and she's always hearing stories that, people are getting ripped off by their doctor. So she's always checking that to be sure what's what. So just keep in mind that that you can check it, you can read it. She has her stuff come to me, I check it. Very rarely is there anything wrong with it. So it can happen, but just, be aware. You can also take a big role in be involved in community health planning. Um, you can encourage pre-paid group practices with your work. There's community health programs to take better care of yourself, take care of your health. All those things can help you in the long run to do that. So if you have a high dollar insurance deductible or insurance cost at your work, sometimes you can choose to go with a high deductible plan, or you may have something that it's so costly to file insurance you don't want to do that. They have a flex spending account. That is something that the IRS allows you to deduct, take off the top of your income, put money aside, and then turn around and spend it for medical expenses. So you can save money to pay for doctor's visits. You can save money to pay for dentist visits. You can save money, and it's done kind of painlessly out of your paycheck. And then you can use that. You can use it to pay for drugs. You can use it to pay for things, so that you're not having to file insurance all the time and or pay for things out of pocket all the time. You're still paying for them out of pocket. You just have saved for it. High deductible health plans can help with costs. Again, you can choose a high deductible. That's great. But if you choose a high deductible, make sure you have that deductible somewhere that you can get at quickly, because if you have a major event like with car, if you have high deductible car insurance and you have an auto accident, they need that money right then, right there. They can't wait for you to cash out a few things or sell your grandmother's china or those kind of things. You got to pay the cash right then. So that can make a difference. Always look for generic drugs. Everyone's well trained to do that as far as humans, and drugstores and even doctors' offices are better at it now. If you use mail order, use legitimate pharmacies, all those things that you can watch for. And sometimes your insurance will dictate where you get it. I've known some people that had group plans that their insurance required mail in drug companies, and the drugs were sent by mail each month to refill your pills. Sometimes that works great, and sometimes the drug you need to have, like, can't do on the mail in, so you have to go to a local pharmacy, but they'll tell you which one to go to, and they've worked out a deal with them. So just know that there are some restrictions out there, but you can also look and see. Something else to help reduce cost is maybe don't go to the emergency room. Go call your nurse. Go to one of those urgent care clinics around town. And sometimes if you see certain clinics, they'll have what they call retail clinics. They'll have clinics set up around town that you can go see, versus always having to go to the physician's office and see a physician, and or go to the emergency room, which can be your most expensive thing to do. Now, when you don't feel well and it's an emergency, the emergency room is great, but that kind of helps you with that. Course, to sound like your parents. You could also work on to reduce cost, stay well. Eat healthy, don't drink too much, don't smoke too much, get sufficient rest, relax, exercise, work out, all the basic things that you know. That can make a big difference. Health insurance is one of those practical things that we work with financial planning. So many things when we go through this class, we go, well, how does this work into our financial plan? Well, health insurance is one of those things, as I said, you have to have the cash to pay for things right then. Now, hospitals will set up a payment plan, that kind of thing. But a surgery can cost you 25, like I said, 12 to $25,000 for just a 1 day surgery, 25 to $50,000 to 75,000, depending on how severe the surgery. And if you have an extended hospital stay, you could be looking at $100,000 pretty quickly. That's a lot of cash for us to have on hand. So by having health insurance, we can help offset that. We can help be sure that what we're only responsible for is our out of pocket premiums and our deductibles and our copays, which we'll get into in just a second. Group health insurance through employers makes up about 90% of all health insurance. So 10% is basically individual policies. And a lot of those 10% individual policies, there's a few that are just straight individual policies where you call Blue Cross Blue Shield and you have a policy that is the Robin Guadagnini plan. Most of the individual policies in the past have been on the marketplace insurance. And so that has helped offset some things because the government's had some subsidies. They've had some restrictions, but they've had some subsidies to help offset the premiums. Now that went away as the big topic was with the big beautiful bill. So this year premiums have been a little more expensive. They'll be more expensive next year too if something isn't passed. I think they'll probably try to do something to help, but keep aware of that and know that if you're on an individual plan, the premiums may get a lot higher before they get better. The reason group plans are cheaper is because the employer is paying part of that cost. Insurance is insurance, and so you can look at it's going to cost you $1,000 a month anywhere. But if you can get a discount, you can get a tax credit. Your employer can pay part of it. That reduces what that premium amount is. So the premium you pay is a lot less than that. The Tax Cuts and Job Act of 2017, which would have been a few years ago, 11 years ago, requires anybody with an employment group of 50 or more to have to provide health insurance to all employees. Now, before 2017, they could kind of pick and choose. Not all employers had to have it. Sometimes they just have it for the higher paid. So there were really a lot of wonky restrictions out there. With that act, it had to be that. Um, and then in June of the next year, the Department of Labor expanded that to affordable healthcare options for small businesses. Small businesses were left in the cold. They still are if it's two or under. Now, Small Business Association can be a group. You can join Small Business Association and get some discounted insurance with that. In 1996, a billion years ago, you probably weren't even around for that one, they created HIPAA, which HIPAA you hear a lot about when you go in. All HIPAA requirements say, HIPAA requirements say. It was a big old hairy bill that tried to give privacy in healthcare. It tried to give portability in healthcare. So if you worked for one employer, you could keep your insurance till you got it at the next employer. If you got a divorce, you could keep your insurance till you could find insurance. Before 1996, if you left employment, they stopped your insurance the day you left. If you got a divorce, they stopped your insurance the day the divorce was final. This gave you the option to have coverage continue. You pay for it, but have coverage continue with the same plan, with the same benefits until you could find something else because it takes a little while to find insurance. So that was a real thing. The other thing we hear about HIPAA was privacy, and that falls under the Accountability Act. And so when you go into a doctor's office or a hospital and they have you write your name on a little piece of paper, then they tear that off so that nobody knows you're there except you're sitting in the waiting room. But that gave privacy. You couldn't go in and look at the list of people who'd signed in that day, which prior to 1996 you could, and go, oh my gosh, my aunt so and so was here today. I need to call and see why she came to the doctor. So they decided that was too much out there. So they gave some Accountability and Privacy Act with that. You do have individual health insurance that you can get one tailored to you. Sometimes that may work out to be cheaper. It can be worth checking. Again, if your employer offers it, I would say that's probably the cheapest for you. They also you can supplement group insurance with another policy. The only thing is that they'll pay for 100% of your expenses. They won't pay for more. So you find supplemental insurance a lot with seniors and Medicare when it gets to fall, and you'll hear all those ads on TV. That's what that is. Medicare only pays for part, then you need insurance to pick up the balance. And that way you just have your premiums out of pocket, but you don't have additional expenses out of pocket. So, and you can do the same with group insurance when you're younger. We just don't always do that. Of course, divorce, I just mentioned, if you can be covered on your former spouse's plan, uh, you're responsible for the premiums, but it allows you to do that. And then Cobra also allows you it's not a snake. Um, It allows you it's a Consolidated Omnibus Revisions Act. It allows you to take insurance with you and keep it going, etcetera. Falls under that HIPAA regulation there too. But it allows you to continue insurance, COBRA does, um, if the divorce happens, if you leave employment, etcetera. Now, again, you're usually paying the full premium. So if you're on a group plan at work, the employer's paying part of it. They're not going to continue to pay part of it when you leave employment. So you're going to be responsible for all of it, which is why it becomes more expensive. But you can continue that same insurance until you can either qualify under your new group. Some employers, when you change jobs, you have to wait 30, 60, 90 days to qualify for benefits. Well, if that's the case, you can keep that going for that point. This is just who's entitled to continuation of coverage. Basically, anyone is spouse, employee, dependent, and child for any of those reasons. So you can just keep that in mind. A good health insurance plan, it should cover hospitals and it should cover doctor's bills. It should provide, if you're looking for one out of, you're making your choices on your own, it should provide at least 120 days hospital room and board paid in full. It should pay for at least 80% of out of hospital expenses. It should have no ridiculous exclusions like we'll cover everything but a gallbladder, since a gallbladder and our appendix are the two top surgeries. You want to make sure those are covered. It shouldn't have an exclusion for that. It shouldn't have an unreasonable exclusion that if you're a woman, it won't cover anything in the female reproductive area. You should make sure it doesn't have things like that because those are considered unreasonable exclusions. Limit your out-of-pocket expenses as a rule of thumb to more than $9,100 for an individual and $18,000 for a family. That's excluding, sorry, dental, optical, and prescription costs. So that's just your basic healthcare costs. So that gives you an idea to kind of look at prices. Of course, we talked about having it cover hospital room and board, major expenses for medical illness. Now, health insurance is kind of like auto insurance. It will have what they call a deductible, and that's what you pay out of pocket. You know that. It could be 200, 100, 500, 700, whatever, but you pay that. That's your deductible. Then they have what they call co-insurance. In the co-insurance section, you're paying a percentage of it, the insurance is paying the other percentage, and so you're splitting the cost in that period. So a lot of times they'll read, you have a $200 deductible, you have a 20% coinsurance up to $5,000, and then that $5,000 is considered a stop loss. At the stop loss, the insurance company pays all. So you'd pay your deductible, you'd pay 20% of bills up to $5,000, and then over $5,000, the hospital pays all of it. That comes into play if you have a big hospital stay, because that's where that calculation would play out the most. Um, for example, a $2,000 deductible, a coinsurance for her to pay 20% of all bills. If her total bill is $3,800, she's going to pay $2,000 for the deductible, and then she's going to pay 20% of that balance of the 1,800. So the insurance company will pay 80%, and then she's going to pay 20%. So her total cost ended up being $2,360 out of a $3,800 bill. So you can see how that works. Hospital indemnity policies, they sell something just if you're in the hospital. So it pays cash benefits if you're in the hospital. That takes care of that. They have critical illness insurance out there, but they are specific to cancer is the biggest one you see. Aflac is one of those that advertises. Also for heart attacks, strokes, organ transplants, they can have specific. And if you have that specific policy, they'll pay over and above insurance for that critical illness because there's a lot of out of pocket expenses. I've known some people that had good health insurance, then they purchased a critical illness policy of cancer insurance. Lo and behold, they get cancer. And there's a point in there that insurance is either not paying or you may go over the maximum that the insurance company will pay, et cetera. The critical illness policy continues to pay you for that benefit. Now, they don't pay for anything else, but they'll pay for anything that's related to your cancer. So, those can be a big thing too. Dental insurance is a big thing to get also. Sometimes your employer offers it as a group. You may decide to buy it personally. You want to be sure if you get dental insurance, it covers exams, basic cleanings, X-rays, root canals. Then figure out what it pays for surgery, crowns, etc. But it should cover the basics, and then give you a percentage of coverage for the other. Vision care insurance is something else you can look at. Falls under health insurance. Usually they pay for an exam. They may not pay for contact lenses or glasses. They may pay a percentage of those if you need corrective vision. So looking at Jane's plan, she has a $1,500 deductible, 20% co-insurance. Her out-of-pocket limit is 5,000, or her stop loss is 5,000. So January 1st, she's going to pay 100% of everything that comes in up to $1,500. Her plan's paying nothing. Once she reaches that $1,500, then she's going to fall into that co-insurance pocket where she pays 20% up to $5,000. But looking at her plan, her first office visit is 125. She pays $125. So that's the reason you want to keep up with what deductibles are and what you set them at. Now she's probably got a good rate for that with that high of a deductible, but she's also going to have out-of-pocket expenses for the year up to that $1,500. Taking the same example, if she reaches the $1,500 deductible, her coinsurance begins. She's been seeing a doctor several times. She's paid the 1,500. Her plan pays for some of the cost of her next visit. Her next visit is $75. So she would pay 20% of that $75 or $15. Her plan is going to pick up the rest, which they're going to pick up the 80% of that and they're going to pay 60. So the bill gets paid the same way, but she's not responsible for all of it at this point. And then there's more costs, of course, as the year goes on. End of the coverage period, she's ending up paying 0%, and her plan is paying 100% because she reached that out of pocket $5,000 limit for the year. So then that means that the insurance is paying for everything. So if she sees a doctor and it's $200. She pays nothing. Her plan pays $200. So you can see how that kind of adds up that way. Long term care insurance. A recent study on the National Council of Aging found that 80% of Americans cannot afford long term care costs. Those have skyrocketed. Um, we have, of course, this big aging population. It's become a market that people have gotten into. There is a lot more competition now with long term care costs, so some of the costs have come down. But if you needed to be in an assisted living or a nursing home or needed help with somebody in your own home, a lot of times you can't afford that because it is so expensive. 40% of the 13 million people receiving long term care services are between the ages of 18 and 64. So not everybody receiving it is over 80, which is what you kind of think of with long term care. It can be very expensive. 1 year in a nursing home can cost over $105,000. And insurance is not going to cover a lot of that. So that's out of your pocket. So you can see why that can add up pretty fast. Um, Annual premiums for long term care insurance can be from 2000 under 2000 to 16,000. So they can be expensive depending on when you buy it. Of course, everything is always cheaper in the personal asset insurance arena. If it's health, long-term care, life, etc. The younger we are, the cheaper it is. So it's kind of one of those things. If you buy it now and don't ever use it until you're 60 or 80, it'd be a lot cheaper to buy it now than it would be to buy it when you're 65 or 70 and start thinking about it, or start you taking care of your parents or grandparents and realize, gosh, I really need to get that. The major provisions in a long term care policy can vary with age, marital status, and dependency because they find that people are married and have dependents live longer than those that don't, live alone longer. There's all kinds of things in there. You can have it where it pays your doctor or hospital directly. You can have it where it pays you directly. You can have it pay a fixed per day for hospital room. That's pretty standard. And so it's kind of nice in those areas to have those benefits because a lot of times if you have a long-term care policy and it only pays X dollars a day, the if it's a reasonable amount, the institution, the hospital, the nursing home, the assisted living, whatever, will a lot of times work around and accept that as full payment or only a minimum amount that you have to pay out of pocket otherwise. So it's worth checking into. Cost sharing in form of a flat dollar you pay, such as $25 to $40 per visit, or 15 and 30 with prescriptions. That's another thing that they look at. It's just a flat thing. Of course, they have co-payments, service benefits, benefit limits, um, coordination of benefits. Again, in life insurance, health insurance, etc. Same with auto. They don't want you to profit from a loss. They don't want you to have a health incident occur, and you can file a bunch of bills and pay out of pocket and then make a big profit. Now, there are ways to profit from them with supplemental policies, et cetera, but a lot of times they look at coordination of benefits so that if one policy is paying your deductible, they've got enough to pay your deductible, they'll pay the balance. So they coordinate that. So you don't have anything out of pocket that you're paying, and the insurance companies are working together. Um, You can look at reimbursement versus indemnity, internal limits versus coinsurance, premiums versus deductibles and coinsurance. So those are things to keep in mind when you're looking at long-term care to try to compare. Stop loss versus premiums, we understand that. And so what coverage should you choose? Well, if you have a choice, should you choose basic or should you choose major medical? If your budget's very limited, basic will handle a major share of your hospital and doctor bills for a small amount of premium from you. Major medical will, in the event of an illness involving catastrophic losses, will protect you from all that because it will cover everything on the major medical. So if you can have a combo of the two, that's kind of nice. But that lets you know what the two. So what are our options and choices out there for health insurance or health care? Well, you have individual policies, of course, we talked about. You have group that's sold to an employer. For hospitals and medical service plans, one of the biggest, of course, is Blue Cross Blue Shield. Blue Cross is a basic company that does hospital care. Blue Shield does surgical and medical services. 99.9% of the time, they are the same company. Blue Cross Blue Shield is what they're joined together as, and they provide hospital and surgical needs. So they provide the whole package. Um, Sometimes there's what they call a managed care. That's kind of like a prepaid health care plan for comprehensive benefits. So it'd be like you pay into an account to then have it paid out for what you need for those issues that come up. It's designed to make healthcare services cost effective by controlling the use. Managed care companies provide information that helps you better manage your health. Some insurance companies you'll find out there may have what they call a managed care person who will call you and say, we offer a smoking cessation program. We offer a weight loss program. We offer these things and we'll take we'll do it for free for you, but it'll help reduce your premiums. And then of course it helps them if those two things, change in your life. So it's a win-win situation. An HMO or a health maintenance organization. They're going to provide health care for a fixed prepaid monthly premium. They make contracts, the insurance company does, with providers, focuses on preventive care. They have basic and supplemental services. If you have an HMO, you're going to be limited on who you can see. You have to see physicians in their organization only. The other option is a preferred provider or a PPO, and that's a group of doctors that agree to provide healthcare at a rate. You have several providers to choose from. Premiums are probably a little higher. Specified services are predetermined. If you go to a non-provider, you just pay more. In an HMO, you pay all of it, and it excludes point of service, or it includes point of service plans and exclusive provider organizations. Now, I will tell you, most plans in the last few years have kind of merged to more of a PPO, and you find less of the HMOs, only because Healthcare is changing, and having a health maintenance organization that's got contracts with a certain group of doctors was great in theory, less great in practice. So it would be like in Northwest Arkansas if you were in an HMO and all you could only see were Mercy Clinic doctors. That's great in theory, except you might need to come to Walker Heart Clinic to see somebody at Walker Heart. Well, that's not in the Mercy Health thing. So that means you'd have to pay for everything out of pocket. That ended up being a little more costly for them because some of those closed groups didn't offer everything people needed. So you see more of a shift from HMOs to PPOs, so you don't hear that term as much as you did at one point. Oh, does your employer offer an HMO or a PPO? Which was unfortunately among nerds like me a conversation at dinner parties. So you know, think how far we've come, how much better things are. But we still break down because you do still find them out there, especially in larger cities. Um, and you do find these terms and these contracts with an employer, with certain employers. So we want to cover them in class. We want to make sure you understand them and that you understand that there are different options out there. So we have HMO, we have EPO, we have PPO, and we have point of service. Okay, so cost, HMOs are generally the lowest of all because, again, it's a set contract with a set amount of doctors. They've worked out a deal, the doctors are happy with it, and that's who they're seeing. An EPO is usually lower than a PPO, paid preferred, because the preferred provider group is broadening who you can see. So because they're broadening who you can see and encapsulating everybody in the area, they're going to be a little more expensive. So they're kind of the Cadillac. They were considered the Cadillac of or the Lexus of healthcare plans because they included more doctors, more physicians, that kind of thing, and more hospitals. You weren't limited to one group, one hat group of doctors and physicians to see. So that it's the most expensive, and the others are all cheaper than that. Um, with an HMO health maintenance, do you have to use providers in the network? Yes. Now, they did allow for emergencies if you were away from town or broke your ankle or on a trip or something and they weren't in your uh, network. They did allow for you to see them and still provide coverage. The other two do allow to use providers in the network. The preferred provider um, basically says you don't have to use those, which is why the answer is no. You don't have to use those providers. It's recommended, of course, that you do. But if you go to somebody out of network, that's allowed, where the others, it's not really allowed unless it's an emergency, but you just pay more. And the point of service, just think of it that you just pay when you go see somebody. That's basically what a point of service is. So that's what that contract is providing. Do you have to choose a primary physician? You do under health maintenance. You don't under the others. Do you need a referral to see a specialist? Under the HMO, yes. Under the others, no. Now they do say on point of service, usually you may have to have a primary physician, and you may have to have a referral. Referral comes into play if you fall, you break your ankle. You can tell it's broken because it's sticking out sideways. Actually, I'll give you a personal. I broke up my baby toe. Stupid accident because accidents are never planned. And it was literally off the side of my foot. I went to the emergency room because my insurance was not an HMO. They called in an orthopedic guy. The orthopedic guy said it. They took care of bandaging it, casting it, etc., and everything was covered. Now, had I been under an HMO, they except it was an emergency, so probably they wouldn't have to. But under an HMO, my doctor, my physician would have had to said, "You need to see an orthopedic." And you're sitting there going, "But I know I need an orthopedic." Well, I have to refer it. And so you have to refer to somebody in network. So that's the reason HMOs kind of lost favor because not everybody liked having to go through their main physician to see specialists. Um, Other options, there's also what they call indemnity insurance out there. And that's kind of the old life insurance used to be sold as an indemnity policy a billion years ago. That was when my grandpa was collecting premiums. But it's basically a fee for service. So it allows you flexibility of who you choose, but they only reimburse a portion of the cost after the fee is paid and the claim is filed. So it's just a different thing. Again, you probably won't come in contact with these, but we want you to know as a class that they are out there and what's out there. Home healthcare agencies. Now, those you'll run into with long term care. Sometimes post surgery, you need home health care. They come to your home and provide aid. They may provide rehab. They may provide wound care. They may provide, just regular checkups. They also, hospices will fall under that also with home health care agencies and have coverage of that or coverage for that. And a lot of times with insurance, you have to do things in order. So, say you have had major surgery, you had some complications, you need to go to a rehab facility. Sometimes they'll send you home first, which you're going, why are you sending me home? But home health care has to follow a hospital stay, and then they can recommend that you need to go to rehab. So, depending on your insurance, things may seem out of wonk, but that's what they're trying to do is do it in the order that the insurance company will pay for it. Sometimes straight from the hospital to rehab and then home with home health care. So, it just depends on how your insurance is, but if that happens, don't go, "Why are they doing this? Makes no sense to me at all." That may be why they're doing it. And then sometimes if you do it out of order, if you come home and then decide you need to go to a rehab hospital, they won't cover that because you did it out of order. So just know that they control a lot of how things are designed. Um, there are self-funded health plans out there. Some of the uh, in Arkansas, the Teacher Association uh, health plan is self-funded, and what they do is they're playing like they're an insurance company. They are underwritten by an insurance company so that if there's a major catastrophe or expense, they have the benefit of having health coverage. But some of them prefer to do a self-funded plan where if they're large enough, they take in all the premiums, and then they have somebody that's basically acting like the insurance company and paying your doctors and paying your clinics, and they're doing that kind of thing. So there are self-funded out there that you run into. You can have healthcare accounts. When we talked about taxes, there were some deductions or some credits for having a health savings account, a health reimbursement account. Again, those are kind of self explanatory. One, you're saving money for health expenses. Once you're looking to reimburse yourself as you go along through the year. They have flex spending accounts, which means you save money and then take it out as you need it to pay for. Sometimes they do better with like over the counter stuff because your prescriptions are covered under your health insurance, so your flex spending will help pay for, Tylenol you pick up at the store, or a brace for your ankle because you broke it, or a cast for a different shoe for your toe because you broke it, like I had to wear for a while. So anyway, this breaks down this chart: employer sponsored, employer sponsored, but breaks down the difference between health savings, flexible spending, and health reimbursement accounts. And of course, being the IRS and being the government, they call them HSAs, FSAs, and HRAs, which is what you'll hear from your employer. And hopefully, especially if you're going into a new job, when you talk to the benefits person, hopefully they will explain all these things to you. But a lot of times, those people in benefits have been there for 30 years doing benefits, and they go, "Well, we have an HSA, we have a 401k, we have a TSA, and we have a this, and you can sign up for all these right here. We'll see you later. Thanks. Bye bye." And then my friends then call me and go, "What is this, and do I want it?" Because I'm the one that translates all the acronyms. So, if you have a question, or if you're that person that gets that, know that you have a place you can go to and look these up and see how they're done. It has to do with whether they're considered pre-tax dollars, post-tax dollars, whether it comes as a credit on your taxes, whether it comes as a deduction of your income, so it reduces your taxes. Some of them let you carry over money at the end of the year. Some of you have to pay all of it in one year. So you want to be sure you adjust how much you're taking out because you don't want to have this credit balance. The ones you can carry over, the health reimbursement account is the one you can carry over. That was a huge thing when they passed that, because the other two basically, um, well, the flex spending for sure, you had to use it up all in the year. So if you were putting aside $100 a month and you got to December and you hadn't used it, you had $1,100 in there. You're going to have 1,200 with the next paycheck. You needed to spend that puppy. So you'll find a lot of surgeries are done in December because they got to use that flex spending account. A lot of Tylenol is bought in December, not just because it's the holidays, but because they got to use their flex spending account. The health savings account now has been added where you can take it with you. They're your funds. So if you leave your employer, you can take it with you. And the health reimbursement account stays with your employer, but you get to carry it over each year. So both of those had advantages that were really good. So just keep in mind that they work the same way, but they all have a little different perk. Government health care programs. Medicare is for people that are 65 or older. Certain disabled persons will qualify for Medicare earlier than 65. That is one of the deductions on your income tax you take out for Social Security and Medicare. It pays hospital insurance, is Part A. Part B pays medical insurance. It's voluntary. So a lot of times people will just get A and C, which is the Medicare Advantage plan. You'll need D if you're going to get prescription drug benefits. Sorry, I can't talk. So if you get A, B, C, and D, you've got all your healthcare covered. Now you do find a lot of people get A and then maybe D or A and B or A and C, and then they have to get the other parts from a supplemental insurance plan. So that's when all, as I mentioned, all those commercials that come out in November, sign up for Medicare, call this number, and an agent will talk to you about your options. That's because there's a lot of options out there. So you can do whatever. You have to have Part A. Period. The rest are based on if you have coverage, et cetera, to do that. You can get it all through Medicare, or you can get it on your own. Sometimes it's cheaper to do it on your own. They also sell Medigap, and because it's just fun to say, they have Medisup insurance. But basically, those are trying to fill the gap of insurance that Medicare doesn't pay. So sometimes you can just look at, I've got A, B, C, and D, but there may be a gap in there it's not paying. Well, then you can buy a Medigap policy or a Medisup policy, supplementals, where that's coming from, and it's going to pay what Medicare doesn't pay. Now, Medicaid is for low income individuals and families. It has federal guidelines, but it is state administered. So each state has different Medicaid laws, rules, etc. And it's for people that are on low income and don't qualify for either the marketplace insurance, don't have insurance at work, and can't afford those things. So Medicaid is kind of open to all ages, etc. It's not 65 or older or that thing. Um, Medicare has a lot of things that aren't covered. So that's the reason people buy supplemental or Medigap policies trying to cover those things that aren't covered. Long term care is not covered by Medicare, which is why we look at long term care insurance, because Medicare, you'd think it's paying for elderly, would pay so much a day for a hospital stay. And it does, but it's like, $25. And we saw that annual figure of, staying in a long term care facility. It's a little more than that. So you got to have something to cover that, either personal assets or something, another insurance policy or something. A lot of times, Medicare does not cover dental or eye. So those are important to look at and to be sure that you can get those taken care of. It does not cover dentures or cosmetic surgery. It does not cover massage therapy. So, and it does not always cover routine physical exams either, which are really strange, or hearing aids and exams for fitting them. So those aren't covered either. So it's very frustrating when people get Medicare and then this is the stage you want all these things and those things aren't covered. Hence walks in the Medigap, or especially the supplemental policies. A lot of supplemental insurance companies out there will cover dental, eye exams. They may not cover massages, and they most likely will not cover cosmetic surgery. That's almost a no-no everywhere, unless it's deemed to be, reconstructive kind of surgery. But they will cover, the basics with those policies that are not covered. Now, long-term care again is another policy. Then there's a new thing called concierge care. We have a few doctors in Northwest Arkansas that went into that, and basically it's kind of a throwback to the old doctor physician that we think of. That was your doctor, your physician. If you were in the hospital, your doctor saw you. If you were in the hospital, your doctor came to you. He might even make a home visit. He might come by to talk to you. It's considered a boutique medicine now, or a premium practice. And so it's not covered by Medicare either, because of course, it's one of those things. That they don't think is really worth it. The thing that I can say, concierge care is great. The only negative is that you have to file for insurance with it, and you're the one that's responsible for filing that, which is why they can do their, extra services stuff. They're not falling into the parameters of what they can cover for insurance, and so you end up being the one that's doing the filing. So it's not for everyone, because not everyone wants to deal with an insurance company and try to file it. So just keep that in mind. But they do offer some great services. Um, Covered items or services you can get from an opt out doctor or provider. So, again, you can buy your policies to cover that. The Centers for Medicare and Medicaid recommend that taxpayers receiving services through Medicare practices use the four R's. The four R's are record, review, report, and remember. That helps to reduce fraud and abuse. And as we talked about, look at your statement that comes in. Look at your explanation of benefits. Kind of like looking at your checking account. Kind of like looking at your charge card statement. Just make sure everything that's on there was your stuff, it was done, it was done, you were talked about with it, etc. So, you can just keep up with it that way. The current rates of fraud on Medicare and Medicaid are about 7 to 10% of all claims annually. And of that, the insured's responsible is only about 1%. The doctors, nurses, pharmacists, etc., they make about 99% of the total fraud. So when they talk about they're looking for waste, fraud, and abuse, they're talking about that, we've got to cut back on this, etc. That's where it's at. It's with the physicians, the providers, the nurses, etc. It's those people ripping off the system. It's not us, and it's not the government. So it's one of those things. If you know the facts, it can kind of help you. In 2010, they passed the Health Insurance and Patient Protection and Affordable Care Act. So that offered tax credits for small businesses to make coverage more affordable. Again, we're a small business. We have 2 employees. We're under the threshold. When we had 4 employees, we got a tax credit to be able to afford a group policy for our 4 employees. It was because before that it was we could not afford it at all. Um, it's prohibited denying coverage to children with pre-existing conditions. Also, pre-existing conditions for women. Trust me, they were carved out, and because you're a woman, a lot of times they would not cover anything to do with pregnancy or female care prior to this act. So it was very important that this was passed. It also provides access to affordable insurance for uninsured due to pre-existing conditions. They would a lot of times, if like say you had chickenpox as a child, they might exclude you from any kind of shingles treatment as an adult. Well, if you've seen the commercial, if you had chickenpox as a child, 90% of us are carrying that as an adult and can get shingles. So it was a really unfair practice. This took that away, which was really nice. It banned insurance companies from dropping sick people. That sounds really sick and twisted, but they did. If somebody got a massive case of cancer, um, and it was costing in the thousands and hundreds of thousands, etc., sometimes the insurance company would just go, "Okay, we're done. I'm not continuing to pay for this trial that you're on. I'm not going to continue to pay for this healthcare that you're getting," and they would just cut them off. And that was the most inhumane thing to do, but they did it. You had horror stories everywhere. The other thing that was really nice that some of you may be taking part of is children were considered children up to age 26, especially if they were going to school, and you could stay on your parents' plan. Before that, it was 18, no excuses, period. And so that really helped a lot of people to continue insurance until you got a job and got on your feet and everything else. They prohibited lifetime caps. We talked about you have that stopgap up to a certain amount. There used to be a lifetime cap, and they would say if your expenses in your lifetime got to $1 million or it got to $500,000, we're done. I don't care how old you are, what's going on, we're done. And that's where they got that perk of cutting people off while they were in the middle of cancer treatments or something. So they prohibited that you could have a lifetime cap on coverage. It was a really good thing to do. And they restricted the use of annual limits. You can only have this much that you pay a year. We're only going to pay your stop loss of $10,000 for this year. So all that stuff made a big difference in getting insurance out to the people and making it user friendly. Now, of course, the insurance companies have charged more because that makes it, their job more expensive, et cetera, blah, blah, blah. But it helped the people, and the people were the ones that needed the help on it because insurance companies were definitely driving the bus on that one. It required new private plans to cover preventative service with no co-payment. So if you needed, an annual exam, that's free of charge or for a nominal fee. If you need annual EKGs or annual X-rays with your exam, you need annual blood work. All that stuff should be at a set price, very cheaply, or no charge at all. And required employers with 20 or more employees to provide health insurance. Remember that first number we looked at was 500 or more or 50 or more. This is now 20 or more. That ticked off a bunch of employers too because they love to say, "Oh, we're a small company, we can't provide insurance." And I get it, it's expensive, but it wasn't fair to the workers. And a lot of times you found too, people left employment for health care. If you could go to another place and get good health care, you didn't really care about this long time association with this boss. So it required employers with more than 20 employees to have to provide health insurance. And that has provided employee retention. It's one of those things, if you take care of your employees, they'll stay. And they expanded Medicaid for the nation's poorest individuals. There used to be even a threshold on that, that if you made this much, you didn't qualify for Medicaid, and it was some ridiculous number that if you had a part-time job, you probably met. So they've expanded the restrictions on that. And then it also increased funds for community health centers to allow for doubling the number of patients seen by these centers. So we have a community health center in Springdale. They're looking at buying a center and putting a community health care down in Fort Smith, the community care clinic up here, and they provide a dentist, a doctor, all the things you might need under one roof, and they provide it at a low cost. They provide insurance, et cetera. And it's basically for those that are like on Medicaid or don't have insurance and need to be seen. And so it's really a nice perk. A lot of doctors volunteer their time there so that they can provide services to participants without um, without an expense out of there, and it's just giving, it's a way they can give back. It's a way they can take care and give back. It also provided new investments to increase the number of primary care practitioners, to increase doctors, nurses, practitioners' assistants. So that kind of gave some added money to clinics. Hey, if we'll give you some more money for this. And of course, it's one of those things too. Insurance co I mean, yeah, insurance companies fought being in the door, of every hospital and doctor. Hospitals fought having to have insurance. Employers fought having to have insurance. Hospitals fought having to have group insurance. I mean, there were just all these different things, but it's one of those things where the insurance company realized if more people are insured, yeah, they have more claims, but they also have a chance to make more money because more premiums are being collected. Well, that was a win-win. Hospitals realized if more people had insurance, they had less losses. They were a more profitable institution, could hire physicians, could buy things now. That's why we're seeing now with this rollback of this provision that smaller hospitals are closing because they're not getting reimbursed. A lot of people in the country don't have health insurance, and if they're not required to have it, they're sure not going to carry it. And then if you go to a clinic and you have a massive heart attack and you all this stuff, you're probably not going to be able to pay. If you couldn't afford a doctor, you couldn't afford a premium, you probably can't afford to pay it. So it was a kind of a win-win for everybody. It was fought. Trust me, they griped and complained about it. And doctors complained about it, of course, too, but they ended up with having reimbursed income. They had more money then to provide for nurses, research, a lab physician. I mean, all this stuff. It made a big difference. And then, of course, it required health insurance companies to have to submit a justification for any premium increase. And the plus there was before that, in the olden days, insurance companies just go, we've had a lot of claims this year in Northwest Arkansas for heart attacks, so we're gonna jump their premiums up. Nobody questioned it. Nobody asked why. Nobody had any control over it. So it might be justified, it might have been a reason, it sometimes wasn't. So this passing of this act made them have to submit why they were increasing it for Northwest Arkansas, why they were increasing it. And a lot of it became you can't increase it for a specific area without increasing it for a specific area of that size everywhere else. Kind of across the board. Gave some accountability to them, which they didn't like, of course, but it really did help. And it also created state-based health insurance marketplaces, which is what we talked about, where you can buy your insurance, where you can look at coverage, you can read what's out there, and there may be some subsidies to help lower income individuals. It also eliminated co-payments for preventive services and exempts preventive services from deductibles under Medicare. And what that means is, if you were getting your annual exam, a lot of times your Medicare insurance say, well, you have to pay 80%, we'll pay 20%. No longer can they do that. If it's a preventive service, it's you're doing it to stay healthy, and it it then it would um, also, they would throw it in under deductibles. They'd throw it in that you had to pay it. They'd say, well, it's, part of your deductible, so you need to pay the whole thing. Now they can't do that. So again, it limited what your out of pocket is, and it limited that the insurance company, if you're doing the right thing and getting an annual physical, you should be rewarded for doing that because you're staying ahead of your health. And that's where that came into play. It made sure that customers have new plans to access. You can look at appeals processes. If you have a complaint, there should be a way for you to complain. That is a no a non-starter that it should be in every policy, and now it is. If you felt like you were wronged, if you felt like you were singled out, if you felt like they didn't listen to you, if you felt like they didn't pay your bill because you're whatever, that gave you a reason that you had a appeals process to go through and jump through the hoops, kind of like you do at a lot of employers. You have an appeals process if you get written up. So they gave you that same process with health insurance. They might deny coverage. Well, why did you deny it? Well, we paid two or three of those this year. I don't want to pay any more. No, that's not a justification. Tell me why you didn't pay it for me. And so that gave you an appeals process. And a lot of times those got reversed and you were able to get the coverage that you needed and something paid that you needed. It also makes states have offices of health insurance to help individuals and help them with filing complaints and help them having appeals. And so that was important too, because so many people, if you had a problem or you had a complaint, where do you go? And you were calling the 1-800 number. I just spent 3 days this week calling a 1-800 number trying to get something corrected unrelated to health insurance. But trust me, if I could have had a direct line or a person, it would have been much better and I would have not spent as much time on it and they would have corrected the issue on Monday and not Wednesday night at 6:30. So that really helped on, like I said, on health insurance because a lot of people had no idea where to go or no idea where to turn. And health insurance is its own beast with terminology and stuff, and it's just overwhelming. Not everybody's going to understand it. So that really did make a difference. It also meant that the federal government, state governments, insurers, employees, and individuals all share in the responsibility of health insurance company. We have to have it. Employers have to offer it. Hospitals have to accept it. It kind of gave this whole thing. And then if you're working with Medicaid or something that's state government, they have to provide it. They have to follow the regulations. So all those things really did make a difference. A lot of people already have qualifying health insurance, minimum essential coverage, but didn't have anything to go above that or anything to go to maintain that coverage. So this helped them do that too. The Affordable Care Act also created the health insurance exchange, which we talked about, where you can go and look at plans. They make it sound, I mean, it is really neat. We've used it a couple of times at work, and you can go in and look and compare plans and look at what covers. Like I said, if you travel in and out of state, you may want to be sure you've got coverage out of state. If you travel out of the country, you want to be sure it covers that. You can buy it specific to a group of doctors if you want. You can buy it more like the um, paid provider PPO, where it covers any doctor that you see, that kind of thing. So it's really good. And college students, if you're in college, not all of you are, but some of you are, what do you need to know about the marketplace? Well, you're on your parents' plan until 26. If you need to get insurance, check the marketplace first. Your school may have a student health plan. Some schools do if you're over 26. There may be a high deductible health plan. That may work out for you because you don't have a lot of issues going on. And so that may be a cheap way to afford insurance. And then, of course, there's always the Medicaid and the Children's Health Insurance Program, or what they call CHIP. Hello, another acronym. Um, and basically, what that means for the health and CHIP program is that insurance is provided for kids, specifically young kids, but all kids with needs, etc. And so there may be some provided coverage with that. And of course, if you get really bored, go to healthcare.gov and read all the stuff that you want to read. But it's got all your questions there if you want to find it. There are over 60 websites. There's domains for health and human services. They have reliable information, but of course, that's a lot to check out. I would say probably if you look at something they've defined as the most reliable, look at the FDA, the NIH, Medline Plus, Health Finder. There's a lot of sources out there, so just again make sure that it's something that you trust. To be honest, the FDA and HHS, the Health and Human Services, uh, you just want to verify their information because they're going through some changes right now, and everything that's on there may not be true. So if you see something and you question it, get out, go look somewhere else and see if that's a true statement, etc. There are a lot of ways to verify in today's times and markets. So just make sure you've got the best information that you need. Okay. Another thing that we get into, we've talked about health insurance, we talked about long term care, kind of falls under that health insurance caveat. Disability income insurance. A lot of times when you go to work for a company, especially if they're a larger company, they will provide disability insurance. And what that means is it's usually short term, but what that means is if you get disabled, um, like you go skiing over spring break and you break your leg and you've got to be home, you've got to keep it elevated, you've got to have traction, you got to have rehab, etc. You may be out for 3, 4, 5, 6 weeks. Well, if the employer doesn't have disability income insurance, a lot of times you use sick days, et cetera, to cover that. So they're still paying your salary. But if you have used all your sick days or you started a new job and don't have your sick days, or it takes 3 months to do it and you only have 5 sick days, disability income insurance will kick in. And what it does is it pays your salary, usually 80% because it's tax free if it's done correctly. And so they're paying you the tax free portion, they're not paying you the taxable portion. And so your take home is about what your take home was, is where that rolls out. And then the employer's not having to pay it, the insurance company's paying it, and your salary continues until you come back to work. They have long term disability that does the same premise. Short term usually goes from 3 to 6 months or under a year. Long term disability is long term, so it's looking at a year or more. Um, and they're just going to pay your salary. Now, doctors, of course, they're big into disability insurance because they want to be sure if they can't perform their job that they don't lose the major income that they've trained so hard for. So um, that's where that is. You may want to have personal disability policy. You can purchase it. A lot of times, as I said, employers will provide it. Sometimes it's what they call portable. So at the end of it, when you leave employment, you have the option to take that disability with you and continue it. It's usually done as a group plan, so premiums are cheaper. Disability is more likely than death at any age. And trust me, I've known a lot of people that have become disabled for short and long periods of time by a total freak accident. Um, and like I said, it provides regular cash, keeps you going with that. And it helps the employer too because they're not out the cash to pay you. They have cash, your salary available to hire a temp that way or do something that kind of can offset that to help you with that. Um, some policies define disability as simply the inability to do your regular job. Sometimes disability says you can't do any job. So you want to be sure how the definition plays out for you, um, because it can make a difference. If you can't do any job, it's a big difference in debating that than doing just your job. Group disability can be short term, long term. Social Security does offer disability if the disability lasts more than 12 months, but you have to be you have to be unable are able to not do any work. So that is a little more strict and stringent, but you can do that. Workers' compensation is provided for all employers with the three or more employees in the state of Arkansas. And that basically is if you have an accident that's work related, that then takes care of paying your disability insurance until you return to work. Um, you will find if you go to see a doctor anymore, a lot of times that they'll say, "Are you here with an injury? Is your injury a result of injury at work?" That's why they ask that question because that gets kicked into that caveat. Disability insurance is going to have what they call a waiting or elimination period. That doesn't mean they're going to eliminate you. That just means that there's a period that you have to wait. Sometimes it's 30 days, sometimes it's 60 days. And basically that just means, you have to be disabled for that period of time before they pay. Sometimes with short-term disability, if they're going to pay for 3 months, you may be disabled for 2 weeks and then they'll kick in and pay. So just be sure of where that definition falls. They'll tell you how long they're paying. They'll pay your salary for 3 months, 6 months, and that's it. They'll tell you what they're paying. They'll also tell you if they cover accident and or sickness coverage, not just you broke your leg. And it should be guaranteed renewable, which means if you're disabled, they can't cancel you. So you get to renew it, irregardless of what the claims have been. So know what your waiting period is when you look at that. Most insurers limit benefits to, like I said, more than 70, 80% of your take home pay. And that's just because if your premiums are paid after tax with taxable dollars, your benefits are tax free. So by doing that, they're just working on making sure you bring home your tax free portion of, not your tax free, erase that from your brain, that you're bringing home your net take home pay is what they're trying to reimburse you for. So that's where that comes into play. Okay, that in a nutshell has covered health insurance, disability insurance, long term care insurance, and being sure that you cover your assets of you, that you are an asset. If you have any questions, let me know.